Hi, it's Dr. Debbie Luke, and today I want to show you what to expect when you bring your child in for an eye exam. Well, first of all, a children's eye exam starting at 6 months of age is covered through Alberta Healthcare. Now, before you see the doctor, we usually start you off in a pre-test room. So that's what the room looks like here. And there are a variety of instruments that will be used to basically get some pre-information to see whether you have any high prescription. We may use a camera device here, looks like this one here. And we take a flash photography of your eyes, and it comes up on our computer screen, and we're able to detect if there's any eye diseases. Another few fun activities we do is checking for color vision. So we have a book with some numbers, and we'll get you to read them out loud for us. But if you can't read any numbers yet, then it's okay. We even have really child-friendly version where we have these mazes where you can trace along the lines here. Another activity we like to do with children especially is putting on some 3D glasses, and we have the picture card with different animals and dots popping out, and that will let us know whether you are using your two eyes equally. It helps us screen for lazy eye. So that's what this test looks like. So let's head over to the exam room next. So here in the exam room, we'll get you to usually have a seat on the exam chair, and we'll have our parents or your brothers and sisters join us at the side. Now you may be wondering, how do we check the eyesight or determine how well a child or a nonverbal patient see if they can't speak to us? Well, instead of telling us what letters they see on the eye chart, we have these paddles. So we'll put them side by side, and then we watch and observe the eyes to see if they look towards the direction where there's a more interesting object on the card. So that's our high contrast card, and we even have one that is a lower contrast card here. You can barely see it, right? So we keep moving back further and further away from the patient until they can't differentiate between the two cards. Then there's a graph that tells us based on distance, it'll tell us how well they can see, whether it's 20/20 or something else. Now the next thing we like to check in our patients is their eye tracking. For children, we have a lot of fun different targets we use to get their attention. So for myself, I love these little finger puppets. We'll put them in different directions and see if the eyes are moving equally and accurately between left and right movement and up and down movement as well. We also usually use different types of lights to see if their eyes are aligned, if they have good pupil reflex. One of my favorite toys is a little ducky, makes a sound, and a really bright light, and this always captures the children's attention. Some other fun toys that I like to use, we got these little monkey, and we have cars. All of these is to make the child feel really comfortable, safe, and be able to perform confidently during the exam through the various examination. And then the other thing that we like to check is, of course, the prescription, and how we do that is by shining a light into their eyes. Because oftentimes in some younger patients, and even nonverbal patients older, they aren't able to use what we call the phoropter. That looks like this one here. So in that case, we put on a cartoon on our TV, and we get them to watch this cartoon, and we use some really gentle lights to shine around their eyes. There's no UV in them, and it's not very bright at all. Just like so. We just look around their eyes, and by putting different lenses in front of the eyes, we're able to determine if they have farsightedness, nearsightedness, and astigmatism as well. And the very last part of the eye exam, we will be checking for the eye health, and there's a few ways we can do that. We sometimes will use an instrument called a slit lamp. It's basically a microscope. We can check for dryness, allergies in the eyes, sun damage, congenital eye conditions. And again, we have another handheld instrument where again we'll shine a light around their eyes, and we'll be able to assess their developments of the eyeball in general. So that pretty much sums up what an eye exam for a young child looks like. If you have any questions, feel free to contact us. Have a great day.